Thank you, Dr. Salee. And I want to take a moment on behalf of my colleagues, Tim and John and myself, to thank you, the faculty and the students, the administration, and the Board of Trustees for this lovely, lovely honor and what has been a wonderful week. I think I speak for all three of us. Thank you very, very much. Who knows what the three-word motto is of our college? De officiis labora. Absolutely. For most of us who have spent any significant time here at William Jewell, those words roll right off the tongue, don't they? What do they mean? Well, I'm not much of a Latin expert, and some of my faculty here might cringe a little bit, but close enough. I think they roughly translate to trust or have faith or confidence in God and work. But what do they really mean? Do they mean to keep your nose to the grindstone? They certainly felt like it when I was here studying or when I was in medical school, I can tell you that. Does it mean to be faithful to God? I think in part probably all of that. But to me now, looking back, what was now 30 years ago, don't tell anybody. I think they mean more than that. I remember many years ago walking around this campus as a student, mostly spending my time in Pillsbury Music Hall, taking courses with one of my mentors, Dr. Arnold Epley, who I'm thrilled is here today, and the many other music professors that I had, and also going to what at that time was Marston Science Building and taking wonderful classes with professors like Dr. Ed Lane, who I'm thrilled is also here today. That's where I spent most of my time, going back and forth, and I think sometimes people weren't sure whether I really belonged in one building or the other, but I enjoyed being in both, and it was a great experience. At that time, Marston was in much needed renovation. It was before it was renovated and well before we had White Science Hall, so you science students should be glad that you have such great facilities. We had wonderful professors, wonderful teaching, but sometimes the equipment was a little old. When you walked into Marston, it looked like you were walking to about 1925 sometimes. And I remember our chemistry lab, for example, especially the organic chemistry lab, was a little outdated, and some of the equipment didn't quite work. And if any of you all have ever taken organic chemistry or microbiology, you know it can be a little odoriferous. And this was no exception. And after a few weeks of trying various things, the small class that we had, small class size, small lab size, we finally gave up on the hoods which didn't work and decided to use the caveman's version of hoods, which was to open the windows, which worked pretty well a lot of days, but not every day. As you know, this is Kansas City. We have rain, we have snow, we have wind with leaves blowing, and you can imagine what some days were like. And those were fairly tolerable. But what I do remember is that sometimes we had some adventure-seeking birds, shall we say, and I do remember one day that a couple of squirrels decided to come in and play. Back in those days, there were very few female pre-medical students here on the Hill, and I was trying to remember back how many there were, and I actually remember only 2 that were clearly dedicated pre-med in my class. The vast majority of women studying science were nursing students. Was a great nursing program. So it was pretty commonplace that if someone found out that I was taking either a biology or chemistry or physics class, that they might ask, "Oh, are you a nursing major?" And that was understandable. And I should add, it never bothered me because many of my best friends were nursing students, many of my best friends now are nurses, and I knew how bright and intelligent and hardworking they were and what great people they were. The common cliche of the day for relatively smart girls who were trying to decide what aspect of healthcare they wanted to enter was nursing is about caring and medicine is about curing. And I heard that lots of times, not here at Jewell, but other places, and many of my colleagues did as well. And I remember thinking at the time how confusing that felt to me and conflicted it made me feel sometimes, because I knew even then that I wanted to care as well as to cure. And I now know that the person who came up with that phrase had no way of having a magic reaching telescope into the future, 30 years ahead, to know how different things would be in this day, that there is often unifying, overlapping input that doctors and nurses have today on healthcare teams. In the old days, doctors often referred to their patients as medical problems. You know, Mrs. Smith is the gallbladder in 202, or Mr. Jones as the lymphoma in 1130. Personal and emotional detachment was strongly encouraged in medicine, even in my early training. Leave the caring to someone else. It's somebody else's job. And no doubt the originator of that caring versus curing cliche never spent a day in the life of a neurologist treating patients. Certainly, I don't have the opportunity to make a difference. I do have the opportunity to make a difference in the lives of some of my patients, directly affecting their disease process. I can stop most of my epilepsy patients from having seizures. I can help most of my migraine patients have fewer and less severe headaches. And I can even now, with newer medications, decrease the frequency of relapses and overall disability in MS. It's a new day in neurology, and we have a lot of things to treat patients we didn't 20 years ago. But while I may be able to quickly and confidently make a probable diagnosis of Parkinson's disease or Alzheimer's disease, I have no way to reverse the disease process or even halt the disease process in many of those patients. And the day that I have to tell someone that they have ALS or Lou Gehrig's disease is a hard day. I know that many of you participated in the ALS Challenge last year, so some of you may have had a chance to learn about this neurodegenerative disease. It often affects relatively young people. Over the course of the disease, they get weaker and weaker, eventually losing the ability to walk, to use their arms, to take care of themselves, to swallow, to speak, and ultimately even to take a breath. All the while, the patient remains alert, able to think, and able to feel. Death is the expected outcome for these people within 3 to 4 years in most cases, and there's no real medical treatment available. In that moment, my job of curing is over, maybe even before it begins. Diagnosis made, no real concrete medication or procedure to offer. Now what? Diagnose adios? Not so. Now the harder work begins, perhaps the real work of a physician, the care. Alleviating the symptoms as I can, pain, nausea, the anxiety and depression that often accompany a devastating diagnosis for someone. Helping the patient, the family, the caregiver know what to expect as the disease progresses. Helping patients make difficult decisions while they are still able to do so. Would they want a feeding tube if they can't swallow? Would they want to be on a ventilator at home if they can't breathe? Is it very important that they die at home, or would they be willing to go to a facility for their last days of care? What do they value as the quality of their own life? What fears do they have? And perhaps most valuable of all, assuring the patient, promising them that I and the rest of the team will continue to be present, walking with them on the steps of this journey that they are about to embark upon. To be available to listen, to provide medications or other treatments as needed, to encourage and support their caregivers. Ultimately, to be a presence of care, to be of service. At the end of the day, 30 years later, that's what our motto means to me. De officiis labora, working hard, doing what you can, and being of service. Having faith that even when it's not super obvious what you can do, no fix, no cure. Faith will lead you in a direction, finding a way to be of service, to make a difference. Every day, I am blessed with the privilege and honor of caring for patients and sharing in that care with students and residents. For me, this is my holy calling. You don't have to be a physician to be of service. Every day you care and you serve just as much, whether your field is biology or business, music or marketing, education or engineering. May the God who inspires us in our endeavors bless you as you serve faithfully today and in your futures. For an education at William Jewell prepares you to do just that.